So for those of you who are not familiar with the Ebola Working Group, it is an initiative by the London School of Public Health and the students in the Masters of Public Health program, as well as PhD programs and other ones. And we are really here to try to understand the complexity of the Ebola outbreak and related problems associated with it through a variety of perspectives. This is the third session in our series, and we'll have a number of sessions following this throughout April. And in April, we're going to have a full-day symposium, which stay tuned for that. It's going to be a very interesting event, and it's hopefully going to help us better understand the complexity of this outbreak. So our event today is about global governance, and we are really lucky to be joined by one of the experts in this topic. As you may know, the Ebola outbreaks have devastated the West Africa in many ways, but one of the things that really is unique to this outbreak is how it's rocked the foundations of many local, national, and international organizations. And there's no one better than Dr. James Orbinski to discuss this issue and shed light on the complexity of this matter. I'm sure for this crowd, there is no need for an introduction to Dr. Orbinski. You're all very familiar with him. So without further ado, please join me in welcoming Dr. Orbinski.
Well, thank you very much. So it's a pleasure to have been asked to do this lecture, or this seminar, excuse me. I just noted at the outset that it wasn't me who selected the title. The title was pre-selected, and I have to say that I was particularly delighted when it was given to me. The Leviathan, of course, well, by the way, this is my favorite philosophical reflection. It reminds me of why working in health and working particularly in global health can be so challenging. But the Leviathan refers, of course, to a very famous political text that was written in 1641 by Thomas Hobbes. Now, Thomas Hobbes was a philosopher, and he was writing about the state of nature, what he called the state of nature. And he argued that only with a strong central government could society survive, and could it, only with a strong central government could it thrive in relation to other societies, so to other states and other nation states. And for those who are unfamiliar, during that period, that was the time wherein the very concept of the nation state actually emerged. It emerged with the Treaty of Westphalia of 1648. And from that treaty, the idea of the nation state gradually evolved, and to the point where we are today. So to be able to reflect on the state of the world in terms of Ebola relative to governance, with the Leviathan really very much as a central concept, I think is actually quite fitting. Now, when Hobbes referred to the Leviathan, he was actually drawing on biblical mythology. And the Leviathan is one of the 7 princes of hell. And that prince is Satan. And Satan is devouring God's creatures. And the Leviathan devours God's creatures through upheaval in the waters of chaos. And it is into the mouth of Satan that the damned disappear at the last judgment. Now, for Hobbes, this, and for the thinking at that time, this very much was part of the mindset. And he was drawing on this concept, this idea that without a strong counterforce, then the Leviathan, as one of the 7 princes of hell, will dominate in a world of chaos. And so the strong counterforce for Hobbes was government, or forms of government. And this really was the beginning of notions of the social contract and notions of the relationship between formal legitimacy and individuals and or collections of individuals in society. So this was a core kind of concept that Hobbes put forward. Now, the Ebola epidemic is ongoing, and I'm not going to go through the meticulous epidemiology that many of you are familiar with. But what I will say is that as of yesterday, there have been 9,600 deaths, 23,000 confirmed 9,600 deaths against 23,000 suspected or confirmed cases. In the last week, the epidemic, as we all know, is still ongoing. There's 100 new confirmed cases in West Africa. And some of the core challenges that have been ongoing throughout the efforts to contain and control and mitigate the epidemic, they actually continue. In Guinea, there were at least one security incident in every district where the epidemic has been present, meaning that there have been attacks on healthcare workers or threatened attacks on healthcare workers, and this continues today. We also know that there have been outbreaks of new cases in previously uncontaminated regions, and this is particularly true in Liberia. And we also know that there have been a large number of cases following inappropriate burial of people who have died and who were not previously identified as Ebola positive. So those simple little descriptors tell me that there are multiple outbreaks still occurring across West Africa, and that the number one issue now is to develop a system and maintain a system for identifying those outbreaks and continuing to engage in active case finding, in active treatment, in active isolation of patients who are found to be contaminated with Ebola. So just so you are quite aware, this is an ongoing problem. This is not something that's over, and it's also clear that this is a relatively new phenomenon, and in fact a new phenomenon for West Africa. Ebola was never previously identified in West Africa. People did not have a name for the disease Ebola in West Africa. There was not any cultural or medical experience with Ebola in West Africa. And this was one of the single most important contributing factors to the emergence and to the spread of the epidemic. So we know that what has happened in West Africa is likely to happen again. In fact, Gro Harlem Brundtland, who was one of the was a former Director General of the World Health Organization, speculated in 2003, so 13 years ago, she speculated on the various circumstances that have now emerged to lead to the emergence of Ebola as an epidemic. She speculated what would happen if an Ebola outbreak occurred in a devastated African country where the security situation was so bad that international experts could not be sent to contain the outbreak, and infected people fled into cities, neighboring countries, and out of the region. Well, that virtually describes what has happened in Guinea, in Sierra Leone, and Liberia. It also describes what could have happened in Nigeria if Ebola had spread to and emerged, or spread to northern Nigeria. It would have been a far, far more serious and devastating epidemic. As we know, northern Nigeria is a deeply contested space. Boko Haram has emerged as a major militant force challenging the legitimacy of the Nigerian state. The Nigerian state itself has as yet, frankly, been quite ineffective in marshalling an appropriate response. It has been so ineffective, in fact, that neighboring states around northern Nigeria have marshaled their own military response and their own intervention force to deal with the threat that Boko Haram poses, not simply to northern Nigeria, but to the entire region. Now imagine a disease like Ebola spreading into a territory like northern Nigeria. Do you think that public health workers would be able to go and work in that area in the same way that they have been able to work under great duress and great difficulty in Nigeria, in Guinea, Liberia, and Sierra Leone? The answer obviously is no. So these are real issues. They're not fantasies, they're not delusions, they're very real issues and very real risks that accrue today and that are far more likely to be far more frequent and perhaps even more severe in the coming years. And I say that because what we saw in West Africa, what we're seeing in West Africa, is what Peter Piot, the man who discovered the Ebola virus, actually described as the perfect storm. And that perfect storm really is made up of a number of very important variables. First, of course, is that, as I've already mentioned, Ebola was previously unknown to West Africa. There was no name for this illness, as the ambassador, the Sierra Leonean ambassador in Geneva told me a couple of weeks back. In the region, there were more than 250,000 people had died after nearly a decade of civil war. Population growth, massive urbanization, massive poverty, massive ecological disruption have been characteristics of the region for at least 15 to 20 years, if not longer. We've also, following a decade of civil wars, Guinea, Sierra Leone, and Liberia were completely unprepared to confront the Ebola epidemic. They had dysfunctional health services. There was profound and still ongoing low public trust